More than 30,000 calls and texts per month. That's what the country's first suicide crisis line has been receiving since its launch in late November, according to the latest data from the Center for Addiction and Mental Health.
It does not surprise me at all. We know that distress is out there and that this service was very much needed. But now the 3-digit, I think we're seeing continued growth in those numbers, which to me just says people were looking for an outlet.
The hotline functions on a partnership model. Crisis lines and distress centers across the country are part of a network coordinated by CAMH and funded by the federal government. Data provided from February shows that the average wait time for a phone call is 18 seconds, 1 minute and 20 seconds for a text. It also shows that of the phone calls that were received, about 12% are categorized as not connected, down from 14% in January. That's more than 2,000 calls per month.
That amounts to quite a few people.
Right. I mean, I think you said initially the important thing is that number is going down. If you drop off right away before you get routed, for example, that counts as a call not answered. So we see that number going down. We know that there were probably a lot of curious people in the first days of the service wondering how it would work.
But one of the most significant concerns raised in launching the crisis line was privacy. While the service says it's committed to confidentiality, texts and calls are traceable.
They're told about confidentiality, but they're not necessarily anonymous.
Yes, and that is an important distinction. Of course, if someone is distressed and we think that emergency services need to be involved, we actually will invite the person to do that with us. That's the ideal.
But emergency intervention, where first responders are called for the individual without their consent, can and does occur. It is legal. However, Crawford maintains that this is rare, happening in around 2 to 3% of cases. The details around privacy are laid out in the terms of use found on the service's website.
We value confidentiality. We also value saving lives.
Now, looking ahead to the 1-year mark, Crawford says the service is forecasted to grow as they continue their community outreach with the goal of having the widest reach possible across the country. For more information, you can head to 988.ca. For City News, I'm Erica Natividad.